And we are ready. Good evening, everyone. My name is Dale Ford, and I'm the Communications Consultant for BAR. Thank you so much for joining us for this Let's Talk Self-Care, hosted by BioConnect and held in collaboration with BAR. At this time, I'm going to hand over to our president, Marilyn Rice Bowen, who will give a few words of welcome, and then I'm going to introduce you to our two presenters from BioConnect. Over to you, Madam President.
Thank you so very much, Dale.
I do.
Just a gentle reminder, please keep your microphone on mute. We started our presentation. You will have an opportunity to ask questions or make a comment a little later, but right now, please keep your microphone on mute. Thank you.
Board of Management of BAR, guest presenters, CEO of BioConnect, Ms. Rachel DeGale and Dr. Roberta Corona, management and staff of BAR, our communications consultant and host for this evening, members all. This evening, we continue our presentations under our theme, Healthy Aging, Aging Strong. Research has revealed that we are living longer. And we are on track, Barbados is on track to record a population explosion of seniors by the year 2050. Those of you who are with us this evening and you are in your 40s, by 2050, you too will be recorded as a senior. As we celebrate Women's Month, we focus our attention this evening on women's self-care. Men do not disconnect. It's important that you understand what your partners are going through, particularly from a hormonal perspective. So today you would leave this session more enlightened. Today I want to discourage everyone from viewing self-care as being selfish. As my grandmother used to say, you can't pour from an empty cup. Therefore, in order for us to take care of others, we first must take care of ourselves. Another quote from an unknown author, one which I will embrace for a while, is, and I quote, "Self-care is giving the world the best of you instead of what's left of you," end of quote. I'm not qualified to dig deeper into women's self-care. Our guest presenters are eager, adequately qualified, and ready to share. This evening, I welcome all to this session and encourage you to hold on to one idea and just exhaust it. I welcome you all again under our theme, Healthy Aging, Aging Strong. Good evening and welcome.
Thank you so much, Madam President, Marilyn Rice Bowen. As she said, tonight's conversation is on Let's Talk Self-Care. And we have two qualified doctors to be able to do that. I'm going to tell you a little bit about them, and they're from BioConnect, as we said earlier. Dr. Roberta Corona is a leading and renowned gynecologist who's practiced her skills in Italy, Belgium, and Barbados. Dr. Corona has extensive experience in several subspecialties like endometriosis, fertility, urogynecology, andrology, and menopause and aesthetics. She is also the first certified menopause practitioner in Barbados. She also has a strong academic background with a PhD and numerous international publications. Always having a love for women's health, she helped to identify the gap in women's healthcare after seeing the lack of treatment being offered to women in perimenopause and menopause from her years in treating women for fertility and seeing hormone levels not being addressed as women got older. This frustration led to the co-creation of BioConnect Medical Center, a medical rejuvenation center of well-being. Her approach is acknowledging the problem with the belief that we need to fight the stigma with it's not anti-aging, it's well-aging. Taking this into consideration, everything, including hormones, general health, skin and body, sexual health, quality of life. You always hear her saying, we don't want to stop time, we want you to live it well. Rachel DeGale is renowned for her passion for excellence. Having been in senior leadership for 20 years and a part of Barbados' most successful medical tourism facility, the Barbados Fertility Center, she helped to open up medical clinics in Barbados, Trinidad, and Grand Cayman. Rachel has a proven track record of being a concept to execution leader. With a background in strong communication skills, she's worked in women's health for the past 18 years. Her passion for helping women thrive is palpable. Her belief is that aging does not need to be seen as a loss, but as a transition, and with the right treatment, can be the best years of life. These ladies are here to talk to us and educate us more on the solutions and medical equipment that is now on the shores of Barbados, and it's all about making life better. Members of BARB, I would like to hand over now to Dr. Roberta Corona and Rachel DeGale. Good evening, ladies. Thank you so much for being here.
Good evening. Hello, everyone. Thank you so much for the great presentation. So I'm going to start with the boring medical part, trying to educate you a little bit on hormones. I cannot talk about every hormones because it would be impossible in an hour, but I promise to summarize with the most important. And then Rachel will continue talking a little bit more specifically about our clinic and what we can offer to make this transition in our life better. So let me start sharing my screen. Okay. So can everyone see my screen? Well, I guess
Yes.
Okay, great. So let me start with the command here. Okay, there we go. So first of all, we said I'm going to talk about hormones, but hormones are part of a big system in our body that is called the endocrine system. This is a collection of glands that secrete chemical messages that we call hormones. Now, these hormones are basically signals that are passed through the blood to arrive to a target organ or a target cells, and the cells or the organ then will process this information and will execute the command. The major glands of the endocrine system are the hypothalamus, the pituitary gland, the thyroid, the parathyroid, adrenal glands, and obviously the pancreas and all the reproductive organs, ovaries and testes. So we are going to talk a little bit about males as well, although the focus is more on women's health today. So what do these hormones a little bit more in specific do? They basically go in the blood. They link to the receptor like it was a key and a lock. So the receptor needs to be right for that specific hormone. And that makes a huge difference when we use treatments to supplement hormones. So more the hormones is similar to the original ones, better will be the function, more effective, quicker, and without side effects. So that's very, very important information that distinguish the use of synthetic hormones versus bioidentical, body-identical hormones. People is a little bit scared of hormones. I see this every day in my practice. They come to me and say, oh my God, no, I don't want to do any hormone treatment, any hormone therapy, without understanding that we are actually made of hormones, and there will be any function working properly if these little proteins will not be made properly and link into the right receptors. The endocrine-related problems are multiple, but we can summarize in three main issues. One is the overproduction of a specific hormone or the underproduction, so having too much or too little, and non-functional receptors. So if the key doesn't open the lock, unfortunately, we cannot reach the target cell, and the message cannot be communicated, so the execution of that specific function cannot happen. One of the main, the most important hormone in our body is the cortisol. It's quite trendy, you know, it's the stress hormone, but I like to call it the fight or flight hormone because it's it's not only negative stress. We use cortisol when we are in, we need to be very focused. So when there is a danger, or when we are doing a presentation or we have an exam, we produce a lot of this cortisol because it helps to bring up the energy and to be more concentrated. So when the cortisol goes too high, then this will result in some issues like increasing blood pressure, increasing blood sugar levels, can affect the metabolism in general, can affect the central nervous system, can affect the moods, and decrease the secretion of serotonin, so give you more depressive moods, and also unfortunately is implicated in increase the body weight because of the blood metabolism, and it affects enormously the sleep and the quality of sleep. One other very famous hormone is definitely the thyroxine. We all know that the thyroid is very important, and we need to have a proper amount of this hormone. And whether it's too little or too much, the problems are very easily seen. The symptoms are really significant. So that is one of those hormone issues that luckily rarely goes undetected, and is one of the most probably tests, although it has some, there are some issues in this diagnosis as well, because unfortunately initially all the levels might look normal in the blood, and if we don't look a little bit deeper, we check, for instance, the antibodies, we don't know that the thyroid to actually make those hormones is overworking. And so we might need to help to supplement a little bit earlier, even before some of the hormones are too low, so that we avoid an overworking of the thyroid gland. And then obviously the estrogen. The estrogen is produced both by men and women. In the women is produced by the ovaries, specifically by the follicles, while in the males it's produced in the testes. And is definitely the main female hormone, and is the hormone that regulates the growth, the development, the physiology of the human reproductive system, so the menstrual cycle, the pregnancy, lactation, the vaginal health, etc. But this is only one part of the estrogen function. Estrogen is so important that it seems there are receptors for estrogen in every single cell in the body, and is really implicated in a major function in our system. One is instrumental, for instance, in bone formation, works together with the vitamin D, the calcium, and other hormones in the regulation of the bone turnover. And as estrogen levels start to decline in the midlife, the process of rebuilding bones starts to slow down significantly. And actually, in the postmenopause, we start losing 20% more bone density every single year. The estrogen also affects the development and aging of the brain, and that are crucial for the cognitive function, like memory. And that implicated also in disorders such as Alzheimer's disease or dementia. They also help in the control of the blood pressure, because they keep the vessels basically elastic and healthy, and prevent the deposit of LDL in the blood that we know as atherosclerotic plaque or atherosclerosis disease. That especially the LDL, that is the bad cholesterol, unfortunately can increase when the estrogen goes down. And this is what really brings to the increase in the cardiovascular risk, but also promotes the blood clot formation. Estrogen deficiency also impair the sugar metabolism and is implicated and associated with insulin resistance. This is basically a dysregulation of the metabolism of the sugars and contribute in the development of diabetes type 2 and obesity. As a strong impact, so in really probably the most important function of our body, cardiovascular, cognitive function, and brain health, bone health, reproductive function, sugar metabolism, fat metabolism. We really cannot live well without estrogen. I cannot stress this enough. One other very important hormone is certainly the insulin. We probably all know this hormone, especially in Barbados. Unfortunately, there is really a high incidence of diabetes, especially diabetes type 2. When the insulin is not secreted properly and the insulin resistant take place, especially in the midlife, in the menopause, with a lack of estrogen, what happens is that we start having basically cravings for sugars and healthy food, and then we produce more insulin, but because the cell is resistant to insulin, instead of breaking the sugar are stored as fat, and it takes a long time, this process, to digest. So we feel after eating, we still very lethargic, we feel low energy, and we still feel hungry because we are not using properly those energy. And the cycle, unfortunately, keeps going and really needs an intervention, and sometimes medical intervention, if the diet is not enough to break this loop of unhealthy habits that can lead to diabetes. The testosterone and the androgen in general are also very important in women. It's not only a male hormone. And to be honest, if we really look at the amount of hormone we produce, women actually produce more testosterone than estrogen in terms of quantity. Yes, the estrogen is the main female hormone, but the testosterone is extremely important. The androgen deficiency is actually recognized now as a syndrome, a real syndrome. And the symptoms are reduced libido, reduced feeling of well-being in general, mood change, persistent tiredness, fatigue, loss of bone mass, because the testosterone works together with the estrogen to keep the bone mass, reduction of the muscle strength, and also difficult to keep the muscles, thinning of hair, and altered cognitive function and memory. The brain fog and the inability to focus and concentrate is very much linked to the deficiency of testosterone. Now, the testosterone is produced both by ovaries, the ovaries 50% and 50% by the adrenal glands. So that makes clear that we need testosterone even after the reproductive age. So the body is producing using two organs, two glands, because it's extremely important. And in the menopause, the ovaries still continue to produce a little bit of testosterone. They don't produce estrogen anymore, but they still produce a little bit of testosterone, although obviously with time it declines. So that's another hormone that needs to be tested in midlife, because it goes together and with the estrogen, the progesterone, the thyroid, the insulin. It's always a matter of balance. And although the hormones have a specific receptors and a specific target, there is a link between all of these functions. And if one of these functions is affected, unfortunately, as a domino effect, can negatively affect all the other functions. We use about 50 different hormones to deal with daily tasks. And as I said, these are all linked, and when they are not, when there is an imbalance, there is definitely lowering your general well-being. Now, symptoms of hormonal imbalance are so many. We cannot, this is already a very busy slide, but trying to summarize really the most important. So let me read this, although I'm going to be bored, but it's really, some of these are often not associated with hormone imbalance, and people really is not diagnosed and diagnosed correctly. And we use, for instance, anxiety. Anxiety is a very typical, a common symptom of lack of estrogen or even lack of testosterone or progesterone. And in many cases, there is no need to take an anxiolytic or to take an antidepressant, where we can simply balance the hormones. And balancing your hormone has obviously a much less side effect than taking a medication specifically for that. Hot flash, sweating, heart discomfort, palpitations, heart racing, sleep problems, depressive mood, irritability, anxiety, physical and mental exhaustion, sexual problems, change in sexual desire, low libido, but also inability to reach an orgasm, bladder problems, difficulty in urinating or increased need, frequency or leakage of urine because of incontinence, vaginal dryness that will bring to burning feeling, pain with sexual intercourse, but also recurrent UTIs or recurrent vaginal infection, joint and muscle discomfort, pain and stiffness, skin changes from acne, dryness, low elasticity, difficult to heal. When you get a cut in your skin and you are older, unfortunately, we all saw that it takes longer to heal. And sometimes it takes too long, and this can be complicated by an infection. Also, hair change, loss or thinning of hair, and digestive issues like feeling bloated, acid reflux, cravings, irritable bowel syndrome get worse with hormone imbalance. Even allergies can get worse. So the list can go on and on. Obviously, there are multiple factors that can affect this function and can give the same symptoms. That's why it's very, very important that you are approached in a holistic manner, so that we can look from different sides and trying to find what's the root of the problem and trying to treat with the most effective and the safest possible treatment. So what can we do to try to keep our hormones balanced? It's not easy with daily life. We are all stressed, and we are all busy with the daily routine, but lifestyle is really important. And as Marilyn said, we need to take care of ourselves. So we need to watch our diet as much as possible. We need to watch what we are eating, but also when we are eating, how we are eating. Too fast, too quick, we are sitting down, or we are just having a bite or a snack to keep on, and then we go home, we are starving, and we eat everything is in the fridge. Maybe the amount of calories is not much, yes, but you're not eating well, and you're not eating healthy. We should try to find time to exercise. Exercising is really, really important for your bone health, for your mood, for your mental health. We need to try to eliminate all the stressor of life. And this can be just stop doing things you don't like, or stop seeing people you don't like. They don't need necessarily to be in your life. Try to be mindful and start to practice good breathing technique and stress relief techniques, and try to do what you like, what you enjoy. And I always recommend in my prescription at the end of the consultation to try to be happy, to laugh as much as possible. Laughing produces endorphins, optimize the immune system, and relax the muscles. And I like to this statistic about laughing. The average child laughs smiles at least 400 times a day. while the average adult is only 15 times a day. So maybe we cannot get to 400, but definitely we can increase to those little 15. And again, this is the same concept that Marilyn was saying at the start, and I really want to underline that. And in emergency and the airplane, the first thing they tell you is fit your own mask, oxygen mask first, because you literally cannot help anyone if you are not feeling well, if you are empty, if you don't have enough oxygen in your body. It's not being selfish, but it's being smart. You need to take care of yourself if you want to help others and if you want to live longer and you want to have a good quality of life. So what can you do? You need to ask for help if you cannot achieve your well-being without it. And there is no shame in asking for help. You might need the counseling. You need to see your GP or your gynecologist at least once per year, trying to check your blood pressure time to time, trying to have a blood test to check your cholesterol, your risk of diabetes. You do your screening for cancer, check for all possible diseases that are affecting your ability to be yourself and to be your best self. There are plenty of solutions, and I think BioConnect, we have many, and we would like to present the solutions to you. So I will leave now the stage to Rachel, and then we'll continue this presentation.
Good night, everyone that's joined us. To everyone at BARP as well, thank you for having us here at BioConnect to share with the entire community the solutions that we brought. So we've listened to Dr. Corona tonight, and we have found out that we are made of hormones. We cannot get away from that. And it's nothing that we have to be scared of either. When we created BioConnect, it really was looking to see what could we do to underpin the healthcare of Barbados. What could we do to help to bring these different solutions? So the last thing that Dr. Corona just said was to laugh. Except one of the things that happens when you laugh as we get older, I don't know if this happens to anyone else, but if you laugh, sneeze, jump, dance, cough, there is that leakage that occurs. And so we know this by the medical word incontinence, but really it's that little leakage, it's that little weenie that comes out, whether you're a man, whether you're a woman, whether it's because of having children, whether it's because of menopause or age. The pelvic floor, actually, if you think of it as a sling that's holding up these organs, that starts to weaken. And so the thing that we brought to Barbados is this machine here in the middle that looks like this blue chair with the light coming out of it. And what this does, it's actually called the M-Cella chair. M stands for electromagnetic, and Cella means chair in Latin. And it delivers 11,200 kegels in 28 minutes. The protocol for this is usually that you do it twice a week for 3 weeks, and we have seen over 90% success with patients definitely seeing a reduction, whether that is in, we're all out there in the world, whether we're in board meetings, whether we are enjoying our quality of life. This is the thing that makes real difference. And we've had many people come to us because they're waking up in the night. We know, when you don't get good sleep, that's the one pillar of health that can really bring everything down. So the M-Cella chair definitely helps with this. And the side effect that we have seen again and again and again from patients is with the strengthening of that pelvic floor, there has been a significant reduction in the back pain. So M-Cella chair, this is something to remember and something to think about. The other thing that we hear a lot with women going through menopause is that sex has now become very painful. As we age, that lining of the vaginal wall begins to thin, it begins to get very dry, and sex becomes painful, and that really can impact your quality of life. we have a phenomenal piece of equipment that Dr. Corona is standing up next to in this photo here, and it's called the Mona Lisa Touch. It's a CO2 laser that she goes in and she's able to perform the technique. And this is the machine that women are stopping me in the supermarket going, "You've changed my life, you've changed my life, you've changed my life." And one of the key factors for this as well is that it is hormone free. So for women that have gone through, whether that's cancer treatment, whether that's chemo, radiation, and they've been thrown straight into the side effect of vaginal atrophy, this is something, again, that you can't find anywhere else but at BioConnect, and it really can change your quality of life. Bone density, Dr. Corona touched on this a bit earlier, that as our estrogen declines, one of the impacts to that is our bone density. And you can see here that we kind of have that peak bone density, you know, here in our 30s, 40s. And then as we start going through menopause, when you start getting to that 50, you can see it in both men and women, that our bone density starts to change and it starts to decline. Well, that's not so good, is it now? Because our bones really are the framework of our house, and our house is our bodies that we hold up. And knowing what your bone density is, knowing what your bone fragility is very, very important. So over here to the right, we have our bone density machine. And we will actually talk a bit more about that at the very end. But here in the corner, we have our radiation-free bone density machine. And again, this was really important when we were setting up for the solutions. Looking again at the cancer patient, that's one of the things that's deeply affected as patients go through chemotherapy, is their bone density. And this is one that you can get tested before, during, and after therapy. And it is something that we definitely recommend that patients get done, you know, certainly in their 50s, and then they can repeat as necessary, or we will actually give you your fragility score for the next 5 years. So knowledge is power. We've all received the phone call of, you know, Auntie Betty that, you know, fell and broke her hip, and then her quality of life goes severely downhill from there. Knowledge is power and health is wealth. So if we can know this key factor, it's something that once you can know the information, you can do something about it. The other thing that we love, so this is one of our, you know, this is the fun part here now, is really love the skin you're in. We talked a lot about the inside, and now we want to talk about the outside as well. Our largest organ is our skin. And here at BioConnect, we actually have a number of treatment options that you can look after your skin with, whether that's anti-wrinkle injections, whether that's dermal fillers, microneedling, facials, chemical peels, or medical grade skincare, home skincare. We have all the options that are really going to make you love the skin that you're in. We talked as well about that cortisol and the abdominal fat. And we see that a lot. We see it in both men and women, that as we age, we get that tummy tire. And it's really important to pay attention to that. It's not just from an aesthetic standpoint, but really it's from a health standpoint. And we have options to help with this. So we have Santa Claus here. And our machine that we brought really is not make-believe. It's all backed by science. So this machine here on the left is called the Vanquish Me. And what this does is it actually helps to kill off the fat. And you can see the big, large applicator there, where it actually sits over the abdomen. The technician's in the room with you. You do it once a week for 6 weeks. And the average that we are seeing is 2.5 inches of loss. You can see our model here, who's a real life person in Barbados. You can see the difference in his tummy, especially going through this whole transition. This stuff works. To complement the Vanquish, we also have M-Sculpt. And M-Sculpt is the muscle building machine. So again, we've got the fat loss. And after fat loss, you may actually want to gain muscle. And yes, there's the aesthetic part to it. yes, to get, that toned look, whether that's on the abdomen, whether that's on the glutes, legs, calves, arms. But in addition to that, we also hear again and again and again, my doctors told me to go and work out, but I don't have the muscle to do it. This is the machine that you can lay on the bed, and in 30 minutes, doing it twice a week for 3 weeks, that's the protocol for this one, you can actually increase your muscle by almost 20%. And then when you have that confidence and you have that strength, then you can go into the gym, then you can do more. So again, this is not make-believe, this is backed by science with over 20 peer reviews. It's clinically tested, it's clinically studied. Science said yes, and there is no downtime. All of these machines that we're showing you, the M-Cell, the Vanquish, the M-Sculpt, they're all non-invasive. So you get to come in, there's no needles involved, there's no surgery involved, and you can see the results. This is a real life person in Barbados once again, and these are her results. One of the other things that we also offer as well is what's known as HRT, or hormone replacement therapy. And Dr. Corona would have touched on the importance of HRT, relieving many menopause symptoms, improving the cardiovascular system. And we actually, at BioConnect, when we started it up, it was one of the things that was a real heartbeat for us, was that we wanted that when patients came to us, that you could get everything here. So we stand by providing you with bio or body identical hormone replacement therapy. And here in the slide, we explain this a bit more, where it really is a compound that matches the molecular structure of your body. So just like Dr. Corona said, it's the key that inserts into the lock. This is, if this is an option available to you, this is something that we also have. In addition to that, we have the medications, but we also have supplements. First of all, not everyone is going to be able to take HRT, whether that's a belief system, whether that's a physiological, whatever the reason is. And sometimes instead, we want to look at supplements, or maybe that's a starting spot for you. But not all supplements are made equal. And it's really important to know this. So we have a lot of health stores in Barbados, and it's important that you really do your research with it. So the difference really between medical grade and retail grade is that there's not a lot of testing that goes on in the retail grade, whereas if you get a medical grade supplement, you can be assured then that it is formulated on clinical data. It does have the highest quality ingredients. They are third-party tested, and there's no, as they call it, pixie dust. We at BioConnect are a very proud supplier of the Pelcom medical grade supplements. And it's something that when you come in and you come in to speak to us, we can then guide you on what's the best thing for your needs, because we don't get everything that we can from food. The soils are no longer what they were, and we all sometimes need that little bump up. So this is something else that we also provide here. And truth be told, time is your most valuable asset. It's the one thing that you can't get back. We can always make more money. We can always do, more things. But once 632 has gone on the 22nd of March, we can't get it back. So we value your time. When you come to BioConnect, here you can get your pelvic ultrasound, your breast ultrasound. You can get, treatment for your vaginal atrophy, or if you need to have minimally invasive surgery, we do that here, whether that's hysteroscopies. We do blood tests here as well. We provide your medications for you. And then we have the other services that I just talked about, which is whether that's the Emsella for the incontinence, whether it's the fat loss, weight loss management, whether it's the aesthetics side. We really are looking at you from a holistic 360 perspective to really make your life better, because that's what we're all about. So we want to say thank you to everyone tonight for joining us. We wanted to give quite a bit of time to question and answers that we can do. And thank you for joining us. You spent your time with us today. So thank you, thank you, thank you. So we've left this slide here because these would be our contact details, that if you wanted to reach out to us, you can either call, email, visit us on the website, and of course, follow us on social media on Instagram or Facebook. Thank you, everyone.
Good evening. Hi, everybody again. Thank you so much for that presentation. It was taking notes. I hope we'll be able, not only be able to see it in the recording, but if you'll be able to share your presentation with us. There's so much information to take in. If anyone has any questions, you can raise your hand using the raise hand icon. I'm checking the chat and I don't see any as yet, but I would like to ask a few questions if I may. We've heard so much information about menopause, some of us, but some women are still not sure when they are actually in menopause. Are there particular signs or particular things that happen that can say, yes, this woman is in menopause? What should we be looking for?
So good questions, because unfortunately, the diagnosis of menopause is actually done 1 year later. So we know we are in menopause when 12 full months have passed from the last menstrual period. But before that year, obviously, there is a long transition. It can be few years for some women, can be up to 10 years for others, and that's what we call the perimenopause. And in the perimenopause, the symptoms actually can start and even be more severe than later on. And then there are obviously those women that undergo surgery. So in that case, if the ovaries are removed, the menopause happens immediately. There is no need to wait for 12 months. And the women don't have a uterus, but still have the ovaries. So they don't have a period, but doesn't mean they are in menopause. So those are the most difficult ones. So if you don't have a period, you still have your uterus, your ovaries, you don't have a period for 12 months, you can say, I had my menopause, that is 1 day, and you enter your postmenopausal stage. If you are unsure, because you had surgery or because you are having symptoms, but you're still having period, but very irregular, then you should probably talk to the gynecologist. And there is a blood test that can be done to help. Not always the blood test is enough, but definitely we can use the medical history, the symptoms, the blood test, the ultrasound, and trying to guide you and give you an idea of where we are. Not necessarily we will know exactly when you will be in the menopause, but we can certainly say you are starting the transition. You are perimenopausal. You are getting there.
Thank you so much. We have a question from Trudy Bellamy. Trudy, go ahead and ask your question, please.
Hi, good evening. My question would be, well, first, I am in perimenopause. I guess maybe a year or two, I believe. I had the ultrasound, which shows that the ovaries are reducing in size, and one of them is, I think, almost shut down. So I am having those perimenopausal symptoms. I've had all the irritability and everything that seems to have subsided a bit. But what really gets me recently is the brain fog, the absent-mindedness, and some bouts of extreme fatigue.
Yeah.
So I'm just wondering what can be done. Are there supplements? I know the doctor said I need to exercise, but finding time, honestly, finding time to do that is a challenge. So I'm just wondering if there is a supplement that could help, especially with the fatigue, because sometimes, I just want to go to bed and sleep for a week or two. It's really debilitating at times with everything else that you have to do in life. Thank you.
Yes, it is, and it's not funny, and I hear you, because we say, well, you don't need to do this, you need to eat well. I also said you need to eat well, you need to exercise, you need to do it, but you are exhausted. and you're busy and you need to you need help. So there are many things you can do, Trudy. Certainly, you can start with some supplements. There are some natural precursor to the estrogen or precursor to the testosterone that can sometimes be very beneficial and help you with the energy. We might need to check also your vitamins levels because also can go down and can affect your energies. And if this doesn't work, you can always start the menopause hormone treatment. We can use body identical hormones. They're really safe and they are really very effective. So obviously, we will need to go through your medical history, see what is your possible risk, and do a balance of pros and cons, and then we can discuss which treatment would be best for you. And remember, you can start with something and finish with something completely different. There is a flexibility, luckily, and we can, it's a journey, and everyone is different, and the recipe that is right for you might be not right for your best friend. So just don't take the advice from your neighbor, oh, she's taking that, I might do the same. I think it would be better to talk with someone that has experience in the perimenopause, and it can be your GP, it can be your gynecologist, it can be us if you want. I would be very happy to have this discussion with you.
All right. Okay. Thanks. Thanks so
You are
much.
most welcome.
We have a question from Jean Small. She wants to know if you do thyroid checks and pap smears.
Yes, we do.
When should women start having pap smears, and particularly when they start getting into their senior years, how often should they have a pap smear?
Yes. So women should start having a pap smear when they're sexually active, regardless of age, especially if multiple partners. But the guidelines says definitely you should start 21, the latest 25 years old. There is no reason to do a pap smear if you are not sexually active, because the cervical cancer can only be started by a virus, basically, that is the HPV. So if there is no HPV, there is no cervical cancer, so it's unnecessary. And then depending which kind of HPV you do, if the standard one or we check specifically for the HPV, we can do repeat every 3 or 5 years. And when you get older, like over 60, 65, there might not need to repeat the pap smear, especially if you are not having the sexual intercourse anymore, or you are having vaginal atrophy and it's extremely painful. So we need to consider pros and cons. But definitely 65, 70, we can slow down, not more than every 5 years, and in some cases it can be discontinuous. It will always be normal for all your life, and there are no factors, obviously, of risk. If it's a woman that had a HPV positive and problems, then it's better to do closer follow-ups. It can be every year, it can be every 6 months, or every 3, slow it down later on. So obviously we need to do the history, but in general, standard pap smear, start 21 years old, or when you are sexually active, do every 3 or 5 years if you do standard of HPV.
Trudy mentioned it too. She said her doctor recommended that she should do exercise, and we all know that exercise is good for you. You know, it keeps the blood pumping. But based on your presentation, it's also linked to the balance of your hormones. Could you just expand on that a little bit more? The importance of exercise and how you can get started, and maybe what are some of the things you can do?
Yes. So exercising has a very powerful effect on your mental health, on your mood and your sleep, because there is a release of both endorphin, adrenaline, dopamine. So it really helps that after the exercising, you feel more relaxed and you can sleep better. And obviously exercising also activates the metabolism, so it can decrease the insulin resistance and you make more muscles, and more muscles, less fat, it means that also your blood sugars, your fat metabolism is more regulated. So exercising is not only for weight loss or to make muscles, it's really part of well-being, should be part of life. And also exercising, especially doing weights, should be always recommended in midlife because it helps to strengthen the bones. So especially in menopause, we should do some weight exercise, weight bearing exercising to keep muscle, to sustain those bones that are becoming more fragile, but the weight itself basically stimulate the bone density to be rebuilt.
Now, our president mentioned earlier that men have a role to play in as women age. They have a role to play. What are some of the roles that men can play? How can they help their wives or partners, more easily go through the challenges coming with aging, particularly as it relates to menopause? You mentioned vaginal dryness, challenges with sexual intercourse. What are some of the things that male partners can do?
They need to know what's happening, and sometimes they just don't know, and they feel rejected because maybe we don't want to have sex anymore, or we never initiated because we don't feel like the low libido. It's not only the pain during the sexual intercourse. We are very fatigued, tired, so we don't want to go out maybe, or we don't, I don't know, we don't take care of ourselves anymore as before. We are very irritable, so we can snap for everything.
And then we're not sleeping on top of that, and it's like it's a full cyclical.
So they start, and I mean, they just don't know what's going on. They start feeling, is it me? Is it the relation? And
has she gone crazy?
Yeah. So knowledge is power, and if they could know, I am pretty sure if they would know what's going on in the body, they would be much more empathetic and supportive. Yeah. And that's what, that's make a huge difference. I see my patient when they come here with their partner, or when they have an understanding, a supportive partner, they go through the journey so much better. And many other, unfortunately, come to me when it's too late. They are separating, they are divorcing because they just could not stand the relation anymore, whether it's because the husband doesn't understand, or because we don't feel like we are adequate, because it's really a feeling of not being enough, not being beautiful anymore, not being young anymore, not being attractive. So it's multiple factors, obviously, but if we could bring our partners with us in this journey, and even at the consultation, I really encourage my patient, bring your partner when we have a chat, because that makes a huge difference.
Yeah. When you have education, you have empowerment, and that really can change all the dynamics at that point in time. We see it again and again in here.
Yeah, I'm glad you mentioned that, because I was going to ask you if if a woman is feeling uncomfortable and she wants to bring her partner with her, if that's something that you ladies can help her to help him feel comfortable with.
Of course.
Definitely.
All right, now Rachel, you spoke about skin, and Dr. Corona was talking about internal, and you were talking about external.
Yeah.
We get these little wrinkles, and we get these little crow's feet, and we get these little things. So I just wanted you, to kind of go back through.
Yeah, absolutely. I tell you, if there's one thing that we've seen, Dale, is, and we didn't show it in the slide, but what we have seen is for men, it's their hair. So we actually do a lot of hair PRP. So where the hair is thinning, we actually do a specific treatment here that actually helps stimulate the hair growth. But for women, it's our face. It's what we present to the world. And exactly as when we started off, it's not about anti-aging. We actually feel that that's like a rash word, and the rash in medicine is never a good thing. But you know, it's not about anti-aging. It really is about when you look in the mirror and you see your best self, you feel your best self, you present your best self to the world. And we've always said that if you change a woman's life, you change your family. If you change your family, you change your community. If you change your community, you can change your country. And if you change your country, you can change the world. And that all starts with looking in the mirror, because I think as we go through perimenopause, menopause, the person that looks back at you is not the same person from a few years ago, from a few months ago. And there's this transition that can even be associated a bit with grief of who is that person? And then you start doing this in the mirror. And then you start pinching, and you pinch, you know, everywhere, and you look and you turn. And we wanted to say, you're beautiful. You're absolutely beautiful how you are. And so for some women, they're like, you know what? These dark circles underneath here, I want this gone. And we can do a dermal filler for that. Some people don't want the wrinkles. There's solutions for that. Some people, the jerky neck. It's like, that's my weak point. And it's all finding out what's the thing that's most important to you. And we work on that. And so there are the injectables, and then there are the non-injectables. We actually have a patient that comes to us every month. And she simply does it she said to me, to be touched. She said, when I leave here and I go to the supermarket, I feel so much better. I'm kinder to the people at the supermarket. Then when I go to work, I'm kinder to the people at work because I feel so good. And there is something to be linked between the self-care that we're talking about tonight, which is exactly as Marlon started off by saying, it is not selfish to take care of yourself. It is not egocentric to say, if my cup is full, exactly as the lady said, I'm going to pour out to all the people around me. And that ripple effect, if we can be kinder and if we can be more positive, I think everyone on this call would agree that we need more of that in the world right now. So that's one area that you can do.
I like that, because some women maybe are hesitant because they don't understand, or two, they think, oh, I'm just being vain, you know. But I think women have understood now just what you said. It makes them feel so much better. So kind of walk us through the process. If I'm thinking of having, that you mentioned the dermal fillers or any of the other fillers, tell me what's the process. They come into your office, and then what happens from there?
Right. So basically, you come into us. You actually will meet with either Dr. Corona. Certainly, if it's an injectable, we'll be meeting with Dr. Corona first, and she will go through. And she has the very wonderful ability to also say no. So she's all very much about a natural look. I think that the thing that scares people about medical aesthetics is that we've all seen, the big lips, or the face that then morphs into something that wasn't there before. That's not us.
Yeah.
We're not those people.
No, that's not what we do, and we don't want to do. So we want to enhance your beauty. Yes, we can correct a wrinkle. We could correct a wrinkle, but we are not doing liftings, plastic. We are really mostly doing treatment to heal your own skin, stimulate your own skin to become more elastic, to produce more collagen. So we use a lot of PRP, we use a lot of skin boosters, more than anything, and a microneedling. So they are all ways to really make your skin better and healthier, and look better, but keeping your natural beauty, keeping your expression.
Yeah.
I like that, because you did emphasize that this is not about anti-aging. It's not to make you look like 16 when you long past.
I think there is something wrong on a 70 years old that wants to look as 20. It's not beautiful. It's not.
Embrace it. Embrace your wisdom.
Doesn't mean that you cannot look the best and you can look look very good, but without overdoing.
Yeah.
I just have just two more questions.
Oh.
Is there a particular age where you say no, you think that this is not an age for you to be able to have this kind of treatment? Is there a particular age where you say, well, no, you know, this is
Are we
this
talking
will
about
not be good?
skin or HRT?
And my last question, ladies, it was really.
Sorry, did you say, Dale, were you referring to skin or were you referring to gynecology?
Oh no, skin. I'm sorry, skin.
Oh,
Yeah.
skin. Yes, I mean, for us, we would definitely, so we do facials from the teen facial. Our youngest patient is 13 in the clinic and our oldest patient is 93. So I just want to give the expanse of what we're treating inside here. But when it comes to those injectables, you would have to be 18 or over.
Yeah, and also it depends on which kind. For instance, there is no point to use the PRP if you are too old, because there are not too many growth factors anymore in your blood. So it will not really make sense. In that case, you might use a skin booster with the amino acid and the peptide instead of a skin booster with the hyaluronic acid. So I think every age have different issues and different skin problems. So we try to be very personalized the treatment based on your problem and your age. But there is no really an age limit besides being 18 and over if you do injectables. You are mute.
Well, I have to wrap up, but I have two quick questions. I know I said I had two and I asked you one already. One is about care. When you get the derma fillers and you get all of these other treatments, what do you advise women to do every day or every night to help, you know, keep their skin moisturized, keep their skin clear and clearing? What are some of the things you do their own self?
Well, I think our medical estheticians would take us out if we didn't promote sunblock. So you got to use your sunblock, everyone, and it doesn't really matter the color of your skin. Sunblock, 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 sunblock. If there's one tip that we will tell you to take away tonight, it is to wear your sunblock. And the truth is we need to start loving ourselves. And that's probably the first step of self-care that we can do, that we can stop listening to the noise in the head and we can start talking to ourselves and just being grateful.
Yeah, definitely.
All right, and my last question, how do we get in contact with you? How would our members be able to get in contact with you if they wanted to set up an appointment or consultation?
Of course, you can always give us a call at 537-6328 or email us at care@bioconnectmedical.com. Visit us on our social media. You can DM us, Facebook, Instagram, visit us on our website. And we would be more than happy to embrace everyone here at work into our family.
All right, a gentleman on our call has a question. Mr. Farrell, I'm sorry I missed your hand, but go ahead and ask your question, please.
Yeah, good evening. I swim on mornings, and in fact, this morning I heard a lady who said when she swims, and sometimes she swims for 2 hours, she does not, when she goes home, she does not wash off the salt water. Now, if you don't do that, what effect, negative or positive, would it have on your skin?
No washing off the
Not washing off the salt water for 2 hours. It's neither here nor there.
No, she swims, sometimes we swim for an hour or 2 hours.
Yeah.
But this morning in particular, she swam for 2 hours. And she said, I do not wash. I do not bathe when I get home. I leave the salt on my skin.
Okay, well, salt is an exfoliant. So
it can make the skin dry.
and it can make it dry. So if you were to implement that on your own, then, you know, again, you could get dry skin from it, by the time it's dried on your skin and you jump in the shower and you want to give it a rub, you should be good to go.
Thank you very much. I'll
Thank
tell
you.
her that.
Thank you as well.
And that was our last question. Ladies, thank you so much, Dr. Carola, Rachel Gail. Thank you so, so much. I've had some messages and they said the session was very informative. They've learned a lot and we're hoping that you will be able to come back so we can have an extended conversation about these very important and critical issues. Barb, thanks you so much for collaborating with us this evening on this Let's Talk Self-Care. And I understand that you have a giveaway. So if you want to give away, you can do that right now.
Thank you for having us, first of all, and it was a pleasure, and definitely we are available to do more of these sessions. We love to bring the knowledge out there and to answer the question. Never too many. So yes, we would like to offer a free bone density to one of our of the people in the audience, whether it's a woman or a man. And I guess our president. Yeah.
Please make your please make your call. Give your name. Your microphone is open. Please mute your mic. Okay, we're gonna have to get Judith to make that. But go ahead, Dr. Corona. You were saying.
No, I was saying we would like to offer a free bone density exam to one of the people in the audience, and I think you can pick one.
Well, because Trudy asked the first question, I think it is only fair
There you go.
Trudy Bellamy is the winner because she asked the first question.
Fantastic. Well,
Congratulations, Trudy.
Yay.
You'll be brave. Be paid.
Thank you so much.
You're welcome, Trudy. Thank you again, ladies. Thanks to everyone who's come on to the call. You've indicated that this has been very informative and you've learned a lot. And yes, I will ask the ladies again if they can come back on for us to have an extended conversation.
No, this is just
so that's it for us. I will say good evening and we hope you continue to enjoy your evening. If you want to, you can reach out to BioConnect on their social media platforms at BioConnect. And give me those numbers again, ladies, very quickly before we
537-6328, or you can hit us up at care@bioconnectmedical.com or any of our social medias. Just search for BioConnect Medical. And we would like to say thank you to everyone. This is the first of many that we will be doing with BART. So continue to watch us. We will soon be, we will soon be sharing with the community our partnership with BART, what that's going to be looking like. So stay tuned to this channel.
We certainly will. Thank you again, Dr. Corona. Thank you, Rachel. Thank you to our President, Marlon Rice-Bowen. Thank you to our CEO, Dr. Jill, and to Judith Clark, to everyone from the board who has been in attendance, and of course, you, our BART members, who we love and treasure so much. And we have so much happening in March. Get prepared for BART on the road on Tuesday, March 28th. We're looking for everyone to come up. We're going to be in St. George, we're going to be in St. Andrew, we're going to be in St. Joseph. Go to the BART social media platforms to get more information about that. So good night, everybody. It was wonderful having you. Bye-bye.